from the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back, everybody. 6:23 is our time now. If you have GERD, it is a very common disease. In fact, 20% of the U.S. population has it. Anyone can develop it, and some may be more at risk for it. Joining us this morning to explain more, Baptist Health Dr. Janelle Dawkins with Sherwood Family Medical Center. Dr. Dawkins, what is GERD? Let's start with that. I know it stands for something particular.
Gastroesophageal reflux disease is what it stands for.
Okay.
I brought this model today just to help everyone understand what I'm even talking about.
Okay, thank you.
So we're going to have to use our imagination this morning, knowing that the mouth is up here. This tube is called the esophagus,
okay,
and this is the stomach. Now, we all know the job of the stomach is to digest food. In my clinic, Chris, I use things that everybody understands, right? We all know a front-loading dishwasher,
right,
or washing machine, rather, right?
Yes.
The way it goes around with the liquid, I want you to imagine that's your stomach, okay?
All right.
And the fluids in there is all the acid. Well, there's a muscle right here at the end of this tube that is supposed to tighten. And every time the stomach digests and everything goes around, the point of this muscle is so that the acid can't go back up the esophagus.
Okay, yeah.
Whenever this muscle right here slackens or loses its grip, the acid comes back up and causes reflux, because right here gets irritated in the esophagus. Too much irritation, it basically gets angry, okay, and sore. And too much, it doesn't feel good at all. Too much irritation can actually cause holes called ulcers.
Okay, yes.
Yes.
It could be leading to more serious issues. What are some of the risk factors for developing or being more at risk for something like GERD?
So basically, the risk factors are things that weaken the muscle. Tobacco, when you're pregnant, it's naturally looser.
Okay.
Some people have muscle diseases that they're born with, so they're predisposed to not have that muscle be as tight. You know, certain foods, this is Christmas time, so everybody's probably not going to be happy with me, but you know, caffeine, chocolate, spicy foods. I'm Jamaican, so I love my spicy food, right? Spicy foods, onions, garlics, those certain foods.
Okay, and let's talk about treatment options. What are some things available to people who develop this?
Right, so definitely if you start developing this, right, like maybe I should tell people, what does developing this mean, right?
Yeah.
Everybody knows heartburn, but there are other things that we naturally, you don't think about, like people who have a chronic cough, especially a cough that worsens at night. Sometimes they feel a lump in their chest. Sometimes it's a sore throat. I want you to come in, talk to your primary care physician, right? At that point, we're trained to make an assessment if this is GERD or if it's something else. So whenever people come into my clinic, my patients, they get a list of foods that we talk about and they're not happy with me, and they're like, well, what do you want me to eat, doc? Like, you give me a list of everything I should stay away from. What can I eat? So we talk about food, lifestyle changes, things like elevating the head of your bed, and then we start on medications usually, and we make an assessment with whether you should go to the gastroenterologist or not.
Okay.
Now, a thing I see a lot since I've been in Arkansas is baking soda. Everybody tries baking soda and think if you stay home and just take baking soda, this is going to go away. It won't go away. I've also been in the emergency room and seen people come in comatose, like people that we have to place on dialysis to get them back, and the culprit was baking soda. So please don't take this lightly. I know it's the holiday season. If you start experiencing some signs or symptoms, stay away from the baking soda. Come on in and we'll take care of you.
Go see the doctors over at Baptist Health. Dr. Dawkins, thanks so much for coming in this morning, explaining what this is and using things that we can understand, because just hearing GERD, we're like, what is that? But you now know, and hopefully you can treat it with the Baptist Health folks. So go to baptist-health.com, call the Baptist Health helpline if you'd like to set up an appointment, and we'll see you next time, Dr. Dawkins. Thanks again for coming in.
All right, no problem.